All right. Thank you, everybody, for joining us. We are with the Utah State University Extension Heart Initiative. And today we are going to talk about 4 things to know about naloxone and opioid overdose. So the first thing, I'm going to turn it over to Tim to talk about myths about naloxone.
Well, good day, everyone. My name is Tim Cady. I'm going to talk about some of the myths that are out there about when we talk about naloxone. One myth is making naloxone available encourages people to increase use or use more potent opioids. In other words, having things like Narcan parties. That's actually false. Studies show there's no evidence from scientific studies that harm reduction approaches like naloxone increases addiction or risky drug use. And for people we work with in treatment, knowing that the response that they're going to get when they try and revive each other is going to be something that's attributed to a severe flu times 100. It's not something most people want to work on when they're doing something for fun. So that does not occur. Talking about naloxone can be abused. That's another myth that's out there, that people abuse naloxone. Obviously, we encourage that, hope that does not happen, but our research shows it is not occurring. Naloxone for 99.999% of the population is a very good drug. It's been used since 1985 in many medical settings and EMS settings for many years also, without people abusing it. It does not cause a high, does not contain any opioid. It's actually something that stops that reaction in a person's body. Another myth is naloxone prevents people from seeking treatment. And that's actually false also. Studies show that people that are trained to use naloxone are more likely to engage in treatment. So something we know is another myth that's out there. It's out there that people think about. And then administering or distributing naloxone is costly to taxpayers. In many cases, obviously that's false. What we do find is that reduces costs, especially when we're talking about response, EMS response, as well as hospital response, as well as time spent in hospitals, as well as death. If we talk about the death of a person in our society currently, is listed between $2 and $5 million. When we talk about the economic impact of a death, all the way up to $10 million. So if anything, administering and distributing naloxone actually reduces cost to taxpayers. And it's something that we know that morally is the correct thing to do. We want to encourage more people to use naloxone.
Hello. Just to start, so we've been talking about naloxone. So what is naloxone? It's the overdose prevention medication that you can use if someone's overdosing. So I just wanted to cover some important things about overdose awareness and how to use naloxone. First of all, we want people to carry naloxone, have it available, especially if you're going to be around someone who's using opioids, such as, heroin, prescription opioids, what have you. You also need to understand some of the signs and symptoms of an overdose, so you can recognize those and then administer the naloxone, which is usually a nasal spray. Some of the main symptoms are, their breathing is irregular or they're not breathing enough. They have pinpoint pupils in their eyes. That's a key sign. Their lips are often blue because they're having trouble breathing. They're turning blue. Those are kind of some of the main signs and symptoms of an overdose with opioids. So you want to know those so you can identify it and then administer them, the Narcan or naloxone. And if you don't have Narcan available, you don't need a prescription to get this. You can go into a pharmacy. They should have it available, and it's kind of like over the counter, but you have to talk to the pharmacist. Oftentimes your insurance will cover it, or there's programs to cover it for free. So we really encourage everyone, especially if you know someone in your life maybe using opioids, to get that and carry it around. One last thing, don't keep it in your car during winter, because if it freezes, it might not work it as it should. So try to keep that in your bag or on you, not in your car.
Hey everybody, this is Gabby. I'm gonna be covering the naloxone education and training. So if you're not familiar with how to use naloxone, or you kind of wanted a refresher or just to get be able to have a kit, have it available so that you can carry it with you. A lot of organizations around Utah provide naloxone education and training. The Heart Initiative, us, we do naloxone education. We do trainings around the state and teach you how to use naloxone, how to administer it. There are also other organizations, your county health department. You can contact your county health department. Many of them have do naloxone trainings and also can may be able to provide kits that you can take. We do have an organization called Utah Naloxone, and they do online virtual trainings. And then if they are able to, they can mail you a naloxone kit afterwards. And there's just a couple more. Those are kind of the major ones that would provide the education and the training. So you can reach out to, like I said, your county health department, Utah Naloxone, and the Heart Initiative. And we have our information at the end where you can reach out to us to get more information.
Thank you, Gabby. I think this information is valuable for anyone to have. We mentioned anybody taking prescription opioids, using illicit opioids, heroin, fentanyl. Anybody should have this information. And also, we wanted to highlight that recovery is possible. Recovery is for everyone. The end of August every year, there is International Overdose Awareness Day. And no matter what state you're in, there's probably an event in your state. There's also events online to honor the people that we have lost to overdose and to hold a space for our grief, as well as provide resources and hope for recovery. And that actually launches us into National Recovery Month, which is the month of September, all month long, and people are celebrating recovery and providing resources and trying to get people information that they need to recover or make those first steps, because as we know, the path to recovery looks different for every single person, every family, and every community. And that is their tagline this year: every family, every person, every community, for the National Recovery Month. And you can learn more about this at facesandvoicesofrecovery.org. This website has lots of events listed on it, so you can go there and look and see what you have locally near you. And you can also go to overdoseday.com to look up events near you and more information about naloxone, overdose, awareness, and that information that you might need. And I'm going to end our presentation with additional resources. Feel free to follow us, reach out to us on our social medias, as well as follow our YouTube channel and our website, extension.usu.edu/heart. Thank you very much for being with us and learning about things that you want to know about naloxone and opioid overdose. Here's a brief reference list, and we thank you.